I was talking about the very famous or popular cow's no. I'm sure you can see it on the screen. That's your powder, and that's your liquid. Many of the dental materials, you do get more powder than liquid, obviously, because the proportion is such that you do need to incorporate more powder than liquid. If you mix properly, the powder should run out at the same time with the liquid. The moment you see lots of liquid but there's no powder left, it means something is not right in the way you are mixing. So that's an example of a type 2 or type 3 or anything other than type 1 reinforced zinc oxide and eugenol. Remember we talked about intermediate restorative material. Okay, next please. So let me just show you a video on how to mix.
Mixing zinc oxide eugenol cement for a temporary in a figure 8 motion. Continue mixing in the smaller increments of powder until the desired consistency is reached. Mix thoroughly and vigorously, completing the mix within 1 minute. For a base or temporary restoration, the cement should be putty like and able to roll into a ball. Then will also
Okay, next please. So as you saw there on the video, the intermediate restorative material, which is a type 2 or a type other than type 1, zinc oxide and eugenol, is actually much easier than mixing type 1. For those of you who have started working in the surgery or those who have been working for quite some time. If it was the type 1, your cows know to be much more difficult than the IRM. Our next type of material is our calcium hydroxide. Many of you are familiar with the dical in our surgeries. Like I said at the beginning, you need to familiarize yourself with the generic names or the chemical names. Because when you go to other jurisdictions, you might not find dical. For example, this product here is called Perfecta line, but it's basically a calcium hydroxide base or liner, just like your famous dical. I know there's another one called Life. I didn't put the picture, or maybe the picture, I'll show the picture later. So what is calcium hydroxide? It is a very low strength base or liner, to the extent that in many cases, you can't use it on its own unless as a sub-base referring to the need to put something stronger on top of the calcium hydroxide before you put the restoration or filling. Why is it often used as a sub-base by many dental therapists and dentists? Because it has got a sedative effect or therapeutic effect on the nerve or on the pulp of the tooth. It also has antibacterial effects. It comes in a powder liquid form, or a two-paste system, or even a one-paste system. Usually when it's a one-paste system, it means it needs a visible light or curing light to activate it. I think many of us are familiar with a two-paste system like this, where you have a base and a catalyst and you mix them 50-50, and then it starts hardening almost immediately. So, like with many of the paste formulations of dental materials, you mix the two with a spatula. Spatula could be stainless steel spatula or a plastic spatula. And you need to mix very fast. I think many of you have been working in the surgeries, know already that dical can really embarrass you, or rather calcium hydroxide can actually embarrass you. Just when you think you're starting to mix, it's already hardened. So you just need to mix it when the dental therapist or dentist needs it, and as close as possible. All right, and I was talking about dical. There's the dical there, example of the most popular calcium hydroxide. Next, please. Time. Okay, so this will be our last slide for this first session. We are continuing almost immediately. You just re-enter using the code that you have for another 40 minutes. So I apologize again for the interruption. That's the diagram that I was talking about. And you also have other products. This one, for example, it's much more different, even in color and presentation. Now, can we take a break? Then we go immediately to the next presentation. So we are talking about a single paste calcium hydroxide. Do you ever use this one? The one on your right screen, on the right of your screen. That's a single paste calcium hydroxide. Have you ever used it?
The one already mixed. The one already mixed.
Yeah, it's single paste. I think it's on the right side of your screen. The one that looks brownish with a hand holding the screen.
Oh, okay, yes, I can see now.
Have you ever used it?
No, I haven't.
Right. So
but I have, yeah, there's a temporary filling material already made. This time, that's the one that I'm mostly using.
Okay. Is this not the, is what, the cold?
And
the cold trim or something. It goes by the name cold trim. I don't know exactly the name.
There is that one also, and there is one which Qual, it's just a written temporary filling. It's a product of Qual Dental, a UK product.
So it's likely to be zinc oxide and eugenol. It's very good.
Yes, and it comes
yeah. So if we look at this single paste calcium hydroxide on your right side, or at least it's on my right side, can you see the two slides? There's one written dical, which is the familiar two-tube system. Then there's another one, the brown one. I don't know, on your phone or laptop.
Yeah.
So this one,
I can see it.
You can see the advantage of this one would be you cut out the mixing. It does not embarrass you or your dental nurse.
Okay.
Because you apply it where you want to apply it. Then you take your blue light, your curing light, then you activate it. That would be the advantage over the two-paste system. So it would be interesting in the future if any of us can try it. I hope it has the same therapeutic properties with our familiar dical two-paste system. Right, Jerry, how many people do we have now?
And Doc, you used it?
I haven't used it. I haven't used it.
Doc,
Hello.
Ditemp.
Is it
Okay.
a dicam? Is it a
Have you used
calcium
Ditemp
hydroxide?
before?
Is it a calcium hydroxide?
Ditemp.
Okay, is it a calcium hydroxide?
Not quite. No, it's a new product on its own, whereby when you use it, you know, it's rubberish, but it's you can change the you use it as a temporary material, and you can change it after a year.
Okay, so maybe on our
Mostly
next,
for those patients who.
So on our next Zoom in October, maybe you can take a photo and project it on the Zoom meeting so that we can also see it.
Oh, okay, I will do so.
We have a lot of people now back, isn't it? All right, welcome back, everybody. I hope we won't have any power cuts. We hardly get them this side of Harare, but today it was quite a big surprise. What a baptism. You can mute Grace now, isn't it? Can you mute her? She's muted herself. So that takes us to preventive dental materials. There are many, but we just took out a few examples. What comes to mind in terms of preventive dental materials are materials such as peat and fissure sealants. And your topical fluoride. So going back to your peat and fissure sealants, they are used to seal. I'm explaining slowly so that our new entrants to the profession can appreciate. I know some of you know this already. So I'm showing you these little small valleys and grooves on the chewing surface of a molar. This is where decay often starts, because this is where your sugar and the substrate and the bacteria hides or hide, as it were, and that's often where your decay starts from. The more the reason why we use a probe explorer to check for early or incipient decay. So what do peat and fissure sealants do? They seal, they close these pits. You can see on your right side what looks like milk or creamy material. That's your peat and fissure sealant. So even if it comes off eventually over the years, often these areas would be very hard. They'll be resistant to decay. All right. They can come in form of a resin. Resin basically refers to something like composite. I think some of you who have already started working in the surgery, you know flowable composites. So they basically look like or feel like your flowable composite, which means you can flow it here like condensed milk. You remember condensed milk? Then use your blue light to harden. Or they can come in glass ionomer based. This one I like more than the resin, because as you know, the glass ionomer material releases fluoride, which we know to harden tooth surfaces or tooth material. So your topical fluoride, often applied to young adults and children using a disposable tray. You can see this, is it orange cherry? It's yellow. That's a disposable tray. This is often done by a dental nurse, the application of fluoride gel. The gel in this case, I think it's green. Is this green? I think it's green. So there are, I think, three main formulations for topical fluoride: acidulated phosphate fluoride, stannous fluoride, and sodium fluoride. So it's good also to just read what your dental therapist or dentist is using. On the picture below here, the fluoride is being applied using an applicator as opposed to a disposable tray. And you have your retractors in place here. Those are retractors. They are just automatic retractors. You put them in and you don't need to hold them. Here, I think the nurse forgot to suck the saliva. Can you see lots of saliva there? All right, beautiful. So next, so cavity varnish, also still under preventive dental materials or materials used for preventive dentistry. So your cavity varnish helps to seal or close the tubules inside the dentine. Those who have done module 1, you remember the layers of a tooth. Outermost, here the white stuff is your enamel, the hardest stuff in the body. Below this, you've got the dentine. And in the middle, you have the nerve or the pulp. So let's talk about dentine. Dentine has small little tubules which behave like nerve fibers. So what cavity varnish does is to seal those tubules which will have been cut during cavity preparation. Remember, we are removing the decay. So before you put your filling, especially on the walls, you can apply your cavity varnish. I would want to know how many people are still using cavity varnish, because I don't know when I last used it. The dental therapists and the dentists, if there are any dentists on the platform right now, it will be interesting to hear how many are still using cavity varnish. So just like with bonding, I'm sure I'm going to talk about bonding. You should apply more layers, 2-3 layers, so that you create greater protection. And this one, luckily, there's not much mixing you need to do because it comes as a single bottle. Please remember to dispense this material just at the time when the dental therapist or dentist needs it. Because if you dispense it too early, the solvent is going to evaporate. So you change the chemical makeup of the material. Let's go to impression materials. What are impression materials? These are materials used by dental therapists or dentists or dental specialists to take the likely imprint of teeth and surrounding areas. The best way to remember it is to scroll your mind back, those who are old enough, to the times when we used to have negatives, photo negatives. You remember that time? I'm sure people like Grace remember. People like Opportunity, I'm sure she's there. Jerry, is she Opportunity there? I think she remembers. She's not old, but I think old enough to remember the times of negatives. You know, you could take your negatives to a photo shop, and then they can develop photos as many times as you can afford. So your impression is a negative imprint of dental structures, teeth, soft tissues, the vestibule, even sometimes a bit of the crevice, gingival crevice. And then you can make a positive reproduction or a model or a cast from the impression. You can do this in your surgery or you can send to the lab. And often the dental surgery assistant has to do the cast. If you are doing it in our own surgery, you have to do the cast. You have to learn to do the cast. Often it's a stud model, but remember there are some surgeries with a back laboratory at the back of the surgery, with a trimmer, with a vibrator, with everything. So you can actually make very good models or casts. If you don't do it, make sure your messenger or the sekuru or that guy, it's often a man, that's why I'm using those words, is trained to do it properly. So I've explained what an impression is. They are subdivided into different classes or classified into different categories. Just for simplicity, we can divide them into three: rigid ones, water-based ones, and the elastomers. The rigid ones are now rarely used, but we include them here as an academic exercise. Right, next. The rigid ones are often not being used anymore. Let me put my picture there. Why? Because they're quite hard. I think they used to use a plaster-like material, such as zinc oxide and eugenol. So it's a very hard material. And so that's one of the reasons. It's cumbersome to use, but we still use a lot of water-based impression material. Many of you who have already started working in the surgery, or those who have worked for many years, there's no way you cannot know about alginate. You have to know about alginate. When you join Zardeno and read our module, it gives you a bit more detail. It goes deeper, and it will tell you that this is a irreversible colloid. So the fact that we talk of irreversible colloid, it means there's a reversible colloid. And an example of that is an agar or agar. Again, not used very frequently in the surgery. So in fact, the text that I put in red here refer to materials that are rarely used in the surgery anymore. But we do include them here so that you know the historical development. So later on in the next few minutes, I'll go back to alginate. I'll even show you a short video, I think less than a minute, on how to mix alginate, because the bread and butter of being a dental nurse. So what are elastomers? Sorry about that. What are elastomers? If you break down this word, elastomer, you see something like elastic. Elastomer. It means a material that can stretch. It means a material that is rubber-like. And for that reason, this material is resistant to deformation. Where's my cursor, Jerry? My cursor is, okay, I can see. As a result, it's resistant to deformation. It's also resistant to, or rather they are resistant to deterioration. Some can last as much as 6 months. In fact, others you can reuse them several times. You can cast a model once, then twice, then 3 times, and it will still be usable. So examples of elastomers, your polysulfide, and the moment I say sulfide, you should know there's some sulfur here. It's right in the word there, polysulfide. So there is some sulfur there. When you read deeper, you find that that's one reason why it's not very popular. Sulfur smells like rotten eggs. Then you got your polyethers. Where's my cursor? The polyethers, look for my cursor here. Your polyethers, e.g. Impregam, still very much in use, Impregam, especially for precision work, crown and bridge, inlays, onlays. It's much more fluid than silicone-based materials. Number 3, they have silicone. This is much harder. It's like a patty. Same thing with your polyvinyl siloxane, like the Speedex patty. Some years back, we used to have lots of Speedex patty. It's a brand. So let's go back to your polysulfide impression material. Again, it's a paste-paste formulation. Always when you get 2 paste formulation, it means one is a base. Don't think you can read that, it's not clear. And the other one is a catalyst. I'm sure you can read that one very well. So If you are not told, or if you haven't had time to read the material data safety sheet, the enclosure, that small booklet, in most cases, you just need 50-50 of each of the material with many of these paste formulations. But please do read. I can also see here the base, the tube is bigger, the catalyst is smaller. But you find that the hole here often limits how much can come out when you squeeze. All right. It also have lead dioxide. I think that's part of the reason why it smells not so well, but it gives a very good impression. Look at that. This is what we call an edentulous arch. This is an upper arch. It's like a person saying, ah, ushamangai. Edentulous means there are no teeth at all. But look how beautiful the impression is. You wouldn't do this with alginate, even with a silicon-based impression material. So as you can see, polysulfides are very good because they are less viscous. They are thin, they flow very well. This is a lower jaw arch, also in a edentulous case. Edentulous means no teeth at all. You have to get familiar with those terms now, especially if you are training. Polyether impression materials, these are sleek, they're glamorous, and you can see manufacturers also present them in a very nice presentation. The tubes, it's still two tube formulation, but the tubes are attached together, and you often use a gun. I hope I'll be able to show the gun. You put this capsule in a gun or dispenser. When you press and you remove this cap here, it oozes out the right proportion of the base and the catalyst. Isn't that beautiful? Isn't that beautiful? All you need is to agree with the dentist how much you need, no sweat. So it squeezes out. Please remember to put the cap. There's the cap. I'm sure you can see my caser there. Back immediately. And also wipe, because here at the exit here, you can have a mixture of both, because this is where both oozes out or ooze out. So you clean before you put the cap. All right, look at the impression. Isn't that beautiful? Beautiful. This is a tray, upper tray with a handle there. Please make note of the sizes. When your dental therapist or dentist takes an impression and they've chosen this impression tray for that particular patient, please make sure you take note of the size. The size of the tray is often written here. I'm sure you can see my arrow. Small, medium, large, S or L or M. Sometimes it's just a number, like 1, like 2. Enter that into the patient's record. Why? Because next time you want to take an impression, you don't want to go through the whole basket looking for the right one to fit. You just select based on your record and you give that to your dental therapist or dentist. So there are new terms that we can introduce here, which gives you an impression about the viscosity of a material. Right, viscosity means how hard or thin it is. Polyethers, for example, they come in 3 types of viscosities: light, regular, and heavy body. I think that's the same thing also with the silicons, although we often use just 2 types of viscosities, the light body and the heavy body. All right. I think we can pass on this. We've done justice to this. Now we come to my favorite, silicone impression materials. This is your Speedex. It comes into 2 pastes, but the paste is very thick. It's putty actually. So here we are showing you just 1 container of the putty, but there are 2. So you take a scoop from one tin and take an equal amount of the scoop from the other tin. And obviously, like we said at the beginning, one would be base, or one would be containing a base, and the other one would be containing a catalyst. All right. Can also be dispensed by a gun. Unfortunately, I hope I'll be able to show you the gun later on as we go along. Here, this is called Imprisu. Again, take note of brand names. They can confuse. You have to know, is this a polyether? Is it a polysulfide? Is it a what? You can't rely on the brand name only. You need to read the finer print. So this Speedex and Imprisu are examples of silicon material. Right, that's clear. These are your scoops. The white scoop must also go to the tin with a white lid. A blue scoop also must go to a tin with a blue scoop. You don't want to take a bit of the catalyst and then implant it into the base when you're scooping because you have changed the scoops. Just keep the scoop to the right container. All right. And these applicator tips, they are used with these capsules. And this capsule is put in a gun. I'm not sure if I'll be able to show you a gun, which helps you to squeeze each of the two, and it comes out already mixed. By the way, this would be your light body or medium body. By light, it means it just squeezes out like a cream. And often you put it first, then where you want to take the impression. Then the dental therapist or dentist will then use a hard body to take the impression if you are using a two-step approach. All right. So I won't complicate things here because this is a technique-specific type of approach which your dentist will have to show you in the surgery. Right, look at the impressions that you get from what is called impression compound. This is like a cake. Impression compound is like a cake. So you have to soften it to make it soft. Usually, I think hot water or Bunsen burner or spirit lamp. I think hot water mainly. And you can make your impression tray. You can make your impression tray or modify an existing impression tray in the surgery if it doesn't fit well. Like here, look at the margin here. We've molded the margins here using impression compound. And often you can retake the impression now after you've extended your tray using your impression compound. This is a complete impression using your compound, as you can see here. Right, there's a tray underneath, but the compound here is acting like the impression material. Alginate, like I promised, we go back to alginate. By the way, they come in different colors. How are we doing for time, Jerry? Okay, they come in different colors. I think if you're a lady therapist or lady dentist, you probably choose something like this, but be careful. This in particular, I think is chromogenic, which means when you mix it, it gives a very good color. I think this is pink or purple. I'm not good with the colors. And when you mix it and when you put it in the mouth, it changes color when it's setting or hardening. Like this one in particular, you can see it has started turning white. So as a dental nurse or dental surgery assistant, you don't want to mix it so long that it starts changing color in the mixing bowl before the dental therapist or dentist has applied it in the mouth, because this is already getting late. In fact, I would say this is already late. It must change color when it has been inserted in the mouth. All right. So this is just an example of alginate. I think the most famous that we grew up knowing about is the blue alginate. Right. At some point, hopefully we'll talk about mixing technique. In fact, I'm going to show you a video in the next few minutes. But this is very important to know how to mix alginate, because the bread and butter of dental surgery. If I can ask you a question, what do you put in this mixing bowl first? Do you put water? Do you put the powder, then put water? What do you put first? Do you put powder, then put water, or you put water and put powder later? These are things that are very, very important. Please watch out for that. That's an alginate impression material, impression, a product of an impression using alginate impression material. This is a irreversible colloid. You just mix the powder with water. When it gets into the mouth, it starts hardening, or rather it should harden while in the mouth, not before you put it in the mouth. That's your tray, metal tray, right? Remember about the size of the tray written somewhere here, and which you must document. So I'll need about 5 minutes, so you can take a short break and rejoin, then we'll just finish. I don't have many slides left. Thank you for your patience. How many people do we have on the forum? Quite a lot, isn't it? So just take 2-minute break while we reorganize. In fact, I still have 10 minutes, Jerry. I might be able to finish, I think. Just keep watching my time. All right, let's watch the video. I think it's not longer than 10 minutes.
Okay, so we're going to show you how to make a good use of algebra. The most important part of the question is having a good use of your algebra. And that will just really help make your clear and diagnostic. So first thing you want to do before you use your powder is swap your powder. So you can take it over once or twice. That'll help form it in the next thing you want to do is always make sure right? Don't just say it doesn't really stay a long time. Right, so always use your correct scoop and your water container right on time. So when you put it on the side, just do a nice scoop and you use your spatula to scoop it out. So it's normally cool. Ready to mix, so make sure again you have your water correct to how many scoops you use the water container. Again, a lot of people don't use it, but I always recommend it. So key is timeless mixing. And then I also use this little technique to help you with bubbles. So what you're going to do is add your water, gently stir it in the powder so it's a huge mess. When it's pretty much covered, put lots of motion against the side of the wall to make sure all the powder is mixed in, all the clumps are out. Once you know your notice all the clumps are out, kind of get along on your spatula and roll along the side of your bowl. This really helps get all the bubbles out, makes your impression a lot better. Once you've gone around the whole bowl and all the bubbles are out, just take one scoop with your spatula all the way around and you're ready to throw it into your tray. Again, we'll make it nice and smooth. That is how you have to make a really good impression to make sure it's all out of the margin. Great. The first thing I have to do is give your patient a paper towel just so they feel comfortable put it all over can, and it'll totally tell you what's going on. When you take it out, you want to try to have the rifle off at one time, but sometimes that's impossible. So sometimes I'll reach my finger up into the buckle, the vestibule, and kind of push down on the side and rocks out.
Right. So that's the mixing and even the taking of the impression. You should remember that in some jurisdictions, dental nurses do take impressions as well. Right. How are we doing with the time? It's time up, isn't it? 5 minutes. Okay. Let's see what we can do in 5 minutes. Root canal related dental materials. When the dentist is doing a root canal treatment, first they establish what is called an access channel. This is what allows them to gain entry to the nerve, to the pulp, then ultimately to the canal inside the root. And they do use what is called a fast handpiece to cut a cavity. So I'm not going to show you a video on this one because it's not very important. What's important is for you to set up the handpiece and to provide the correct base. Right, so the access has already been created. Now it's time to do what we often refer to as filing or instrumentation. So that's your root canal file, cleaning file with its flutes to enable it to clean whatever is infected inside the canal here. This tooth in particular, at the periapical, small abscess, periapical meaning around the end of the root. Around the end of the root, that's your root. That's another root. And inside each root, you have your canal here. And because this tooth was diseased or affected, it ended up with a problem here. The more the reason why it needs a root canal treatment. All right, so these are examples of root canal files. The dental surgery assistant needs to know the different color codes. This is gray, this is white, yellow, red, blue, green, black, and white again. These color codes signifies the size of the file. For example, this is a 0.8. This is a 10 thing. That's a 15, 20, 25, 30, 35, 40. And white again. That's 45. So you see 45 is white, 15 is white. 20 is yellow, but if we get to 50, if we had got to 50, you find that it's yellow again. So that you're able to set the files again if they are all mixed up, especially after sterilization. You can set them up again in a chronology that allows the dentist to move from small to bigger to bigger to bigger, and so on and so on. Right, so those are your root canal files. So when you set up your instruments or your tray setup, you don't only set up your files in the order of size, but you also have to know which stage the dentist is at. For example, we can assume this stage is the filing stage. Remember, filing can be? Okay, just a break, just 2 minutes break, then I'll finish. Just take 2 minutes break, then I'll finish off. All right, just stretch up. So I prepared this slide to show the nurses that you need to put water. The bigger syringe obviously is for water, ordinary water. But you can use distilled water or even normal saline, that's fine. The smaller syringe obviously it's your irrigant. I often use sodium hypochlorite, jig, household jig, but not any household jig. It has to be at least 5%, I think. 5% when you buy, 5%, then you dilute, you can dilute it. But now we also have commercial preparations of sodium hypochlorite. It's already diluted. All you need is to aspirate it. And your pepper points. So pepper points are also color coded. That's 45, 50 yellow, white 45, red 55, also comes in size 25. It's also red. That's your blue, size 60, but also size 30, and so on and so on. So irrigation is very important during root canal treatment, the earlier stages. Copious amounts of water and also the irrigant, because this is the one that's going to dissolve the organic material. Do you have someone else other than Grace? No. Okay. So EDTA is another irrigant that is often used. It's very good, this one, for dissolving clogged root canals. If the irritation in the pulp is chronic, the tooth might attempt to deposit calcium deposits. So EDTA is very good for dissolving that away. Also hydrogen peroxide can be used, and also chlorhexidine. But I don't want to say many, but I prefer sodium hypochlorite. It's very good. It's very good. Right. There are dentists who now use rotary systems for filing. They don't do it manual anymore. So that's your endodontic mortar and your special slow end piece there. And they don't use many files. Often they just use three or four. And this is an example of a system that they call a pro taper system. Again, you have to know the sequence that the dentist will be using, so that you provide them as and when needed in the right sequence. So this system is fast, it's efficient, but we always reserve the manual system on the side, because sometimes the root system is so crooked that you can't use this all the time. That's your pro taper versus your manual files. You see, they're much thicker, but you might be shocked that thick as they might appear, they are quite flexible. They can actually follow the anatomy of the root system very well, and they don't break that easily. I don't want to say they don't break at all. They don't break that easily. So they look fat, but they're quite flexible. And this is a comparison with your K files, the manual system where you use your hand to clean the root system. Okay, I actually took this one from my laptop. You will need a lot of x-rays when you're doing root canal. This is root length, root canal working length determination. So obviously this x-ray was taken initially, then you push your file more, then you take another x-ray. We can agree this one is overshot. The file is overshot a little bit, maybe by a millimeter. So then the nurse has to record the working length. You have an endo ruler by the side, and once you determine the working length, it must be recorded by the dental nurse, obviously, or by another dentist assisting the primary dentist. So that when the patient comes next time for further filing or even for obturation, you keep to length. You keep to the length. This overshooting means your file obviously going beyond the root. This is not good. It can cause post-operative failure. Okay, so the role of the nurse here is to make sure the endo ruler is there and the working length is nicely recorded in a way that makes it easier to make reference on subsequent visits. That's an example of an endo ruler. It's a short ruler, metal ruler. It can also be a type that can be hooked to your finger here, so the dentist can do it much easier. Okay, so in between visits, the root canal system is dressed with medicaments, antiseptic medicaments, sedatives. This is an example of a medicament that can be used to dress the root canal system. This is your letter mix. If it's very painful, the nerve is very fresh, you just make sure your paper point is dipped in letter mix, and then it's put into the canal, and you close with your temporal filling. That's an example of a ready-made. Grace, are you there? Example of a ready-made temporal filling, Toxavit. It's not very strong. This one, I don't normally use it for interval dressing because it can fail easily. Right. So this is your cresophane letter mix. These are materials that can be used to dress the canal while waiting to obturate. This is the temporal filling material that I prefer to use in between appointments. Your Durelon, that's a carboxylate cement, very strong. You can also use a glass ionomer. This is Fuji9. And Grace, we were talking about ready mix temporal filling material. I think I wanted to say coltazol. Coltazol. We need to read and see if it's a zinc oxide based or it's a zinc oxide free ready-made temporal filling material. Again, this is not very strong. You might find the dentist might prefer either of these two rather than the coltazol. But if you're in a hurry, that's just as good as well. Right. You can even use amalgam. You can even use amalgam depending on the circumstance. Even composite, because remember what you don't want is recontamination of the root canal system. So now we come to sealing the root canal. It needs to be filled. So the assistant has to make sure before the patient arrives, they have the right materials on hand, not to be running around like a headless chicken between surgeries looking for materials. Your gutta percha, a root canal sealing material. This is Silapex, for example, and this is Silapex, which is a calcium hydroxide based sealing material. You can also have zinc oxide additional based type of root canal sealer. This is Endomet. It's called Endomet, and there are many. It's just an example of the common ones. And the two-paste system, obviously, it's much easier to mix. This one, like zinc oxide and eugenol, it's also a bit harder to mix. All right. That's another type of root canal sealing material, your AH plus AH26, AH26. This is a resin-based type of filling material, much stronger but very expensive, but has better results than the previous ones. Your gutta percha, different sizes, and also color-coded, like your paper points and the endophiles. Then the dental surgery assistant has to be familiar with the color codings and the sizes as well. All right, gutta percha comes in different sizes. This has been explained. Your organizer, the nurse has to be careful not to drop this. If you were to drop this, then it's a big mess. Because sometimes that's all we have in the surgery. And they're not easy to disinfect or sterilize because it's rubber, remember? So this is something you need to hold with your mind on the job, not with your mind half on the job. So after your obturation, that's your obturation, then you put a filling there. This is before root canal, and this is after root canal treatment. Okay, who is there, Jerry? Okay, welcome back, Opportunity. I hope you didn't miss a lot. After root canal treatment, it's often recommended that you put a crown. Opportunity, I'm sure you can follow. Look at that tooth, it is fractured in the middle here because the crown was not put. So sometimes the dentist is in a hurry to go to the next room. You just have to emphasize this. In our surgery, we make the patient sign to show that they've understood, because they can come back, then they blame us for not having told them or given them the option of a crown, because all that work of doing a root canal is gone to waste now. You just have to remove this tooth. So that's an example of a crown. It's a complete crown. When it's like this, it's a complete jacket crown, because you can have a 3/4 crown or a half crown, but this is an example of a complete jacket crown to prevent fracture. So that's the end. Who is there with us? It has been a long session. Oh, grace and opportunity, and honor. Honor. Let's have honor introduce himself or herself. Yeah. Is this correct, Jerry? Jerry, I want honor to talk to us. We ask her to unmute. Yeah. Honor, can you introduce?
How are you?
Yes. Where are you based?
Yes, I'm based in Marondra, Dr. Mandish's office.
Okay, we are very happy that you are so resilient. Were you with us when we started? You know, we had disruptions this afternoon.
Yes, I was with you when you started. When the sessions before.
All right. So this is the end of our dental materials presentation. We will edit it out and put it on YouTube. So we'll take a long break. I think from now onwards, we'll do longer sessions. Sometime in October, we'll do a long session, maybe 1 or 2 in October, on cross-infection control and microbiology. So let's take a long break. Thank you guys for being with us till this hour. What time is it? I think it's almost 3:30 now. Yeah, 23 to 4. That has been a very long session. Enjoy the rest of the weekend. I hope you have learned something from our presentation. We apologize.
Oh, yeah.
We apologize
No,
for
it's quite
disruptions. Go ahead, Grace.
it's quite refreshing, and it reminds me of the times when I was your student. And really, everything is just recap. I'm recapping everything. Thank you so much. My son is benefiting a lot.
Will benefit as well.
He is benefiting a lot. He's also, he has been here
All right.
the whole time. So thank you so much.
Okay, bye-bye,
Please send me
everybody.
the clip. Bye.
Okay,
bye,
bye.
everybody.
Bye. Thank you so much.
Okay, bye. I need to convert it.